How do you know if you're pre-diabetic? And how do conditions like endometriosis contribute to the onset of diabetes and even heart disease? I didn't know until I did Randox's Everywoman health check, which tested 150 biomarkers, and I was shocked at what I found out. Before I dig into my Randox test results, let's first understand diabetes and metabolic health. What does it mean to be pre-diabetic? Pre-diabetes means that you have high blood sugar levels and are showing signs of insulin resistance. Metabolic health refers to how efficiently your body processes energy, regulates blood sugar, manages fats, and responds to hormones like insulin, all of which directly correlate with conditions like diabetes and heart disease. For women with endometriosis, so women like me, metabolic health is crucial. Research shows that women with endo have a 30 to 80% higher risk of autoimmune and metabolic conditions, including insulin resistance and dyslipidemia, meaning unhealthy fat levels in the blood. To assess for metabolic syndrome, Randox checked my BMI, that's body mass index, my waist to hip ratio. They took blood to test my fasting glucose, my HbA1c, insulin, HDL cholesterol, triglycerides, and high sensitivity CRP, C-reactive protein. And they checked my blood pressure. My results are in, and I'm going to tell you now, I was pissed. Let's take a deep dive, and trust me, there's going to be a lot of beneficial info shared here, so be sure to share and save for later. Now, my body composition report says that I've got great metabolic health. I'm muscular with 22% body fat, and my visceral fat is super low. My metabolic age is 15 years younger than my chronological age. Hashtag winning at life. I mean, if you look at me physically and you stereotype, I'm your picture of health. But my other metabolic markers tell a different story, and I'm so grateful to have this information now rather than later, thanks to Randox. My fasted blood glucose is in the pre-diabetes range, indicating early insulin resistance. One thing to note about glucose testing is that one test does not reflect overall blood sugar levels. That's where wearing a continuous glucose monitor can be handy. So it's better to look at your HbA1c. HbA1c reflects your average blood glucose over the past 2 to 3 months. Mine is normal, albeit on the slightly higher end of optimal, according to functional medicine. This means that my glucose is pretty stable. Moving on to insulin, by conventional standards, my levels are normal, but on the slightly lower side. When combined with my blood glucose, it suggests early insulin resistance. Next up, triglycerides. Triglycerides come from your diet and are the most abundant form of fat stored in your body. Any food not converted into energy by the body is stored as triglycerides for use later on. High levels indicate an accumulation of cholesterol and fat within your blood vessel walls. My triglycerides are elevated, indicating metabolic stress. Finally, let's look at LDL cholesterol. That's your so-called bad cholesterol, as it deposits excess cholesterol in the walls of your blood vessels, which can narrow them and lead to blockages. Think stroke and heart attack. My LDL is borderline high. So, as someone who lives an anti-inflammatory lifestyle, who exercises, who has lean body mass, why does my blood work seemingly contradict my physicality? I'll tell you why. Endometriosis, inflammation, and thyroid health, and genetics. I have endometriosis, and as I recently shared, my Randox results reveal that I have high inflammation and I have high levels of thyroid antibodies, indicating Hashimoto's. Chronic systemic inflammation can impair glucose uptake by the body, resulting in higher levels left in your blood. Inflammation also disrupts insulin signaling, and it can increase unhealthy fat levels in the blood. It oxidizes LDL, making it more likely to stick within the inner lining of your blood vessels. Moving on to thyroid health. Suboptimal thyroid function and autoimmune thyroid issues can slow down metabolism, which will also raise blood glucose levels and elevate lipids, raising both LDL and triglycerides. What seems clear as day here is that endo, inflammation, and thyroid antibodies are attempting to push me into pre-diabetes. And I had no idea. The most important thing is that now I do know, and I can start to do something about it. Prevention. Diabetes, heart disease, stroke? No thank you. If you want to know where you stand, Test your metabolic markers, which you can do with Randox by choosing either their Everywoman or their Discovery package. And don't forget to use my code ENDOSTASIS to get 12% off. Links in my bio. Next, I'm going to share my surprising nutritional levels, courtesy of Randox's Everywoman test. So stay tuned.